this is the kind of dad bod that we want. Like, that wasn't scripted or planned. So it's really funny to hear him say, like, I want to be the fit dad. Because, like, hey, you look like you've done it. Okay, keep it up.
Hello everyone, this is Mahmoud. This video is gonna be different. انا هتكلم بالانجلش عشان معايا ضيف النهارده هو شويه مختلف. حبيت ان انا كل الناس كانت بتسالني على فيزيو سيرفيس، بس حبيت ان انا كمان اقعد مع chiropractor بحيث ان انتوا يبقى عندكم فكره اكبر عن الماركتنج عامل ازاي والدخل كمان عامل ازاي. Hello Dr. Adam, how are you?
Hey, Mahmoud. Good to see you.
I'm so happy that you invited me to join today.
I'm happy to be invited onto your channel too.
Oh,
right?
that's
Give and
amazing.
take. I like it. I'm happy to be here.
That's amazing. Give us idea about what you do and how's the chiropractor story.
Yeah. Okay. So I am a chiropractor, a doctor of chiropractic. A lot of people living in North America know what a chiropractor is because it's just kind of part of their everyday to day, but not everybody in the world is necessarily familiar with it. We're a type of musculoskeletal alternative doctor. So what that means is that we do a lot of non-pharmacological work. We don't use drugs at all, is what we do. But we work a lot on people's muscles, their joints, their bones, their cartilage, their ligaments. If somebody has like a pain or physical injury, that's kind of our domain, right? So of course we work alongside other physios, medical doctors and whatnot. But that's kind of what I treat on a day-to-day basis of people with those issues.
Do you think only the people who are injured or have problems, they should visit the chiro, or everyone should be?
Yeah, so everybody can benefit by seeing a manual practitioner. When I say a manual practitioner, it means somebody who uses their hands or physical force to work on their body, right? So, of course, I use the example of injured people because that's probably the most easy to understand, or the idea of the typical patient that comes to mind. But we actually just finished filming you, even if you don't have any acute
I'm going to share part of the video over there. Yeah?
Absolutely.
Yeah.
So,
To get the neck to go properly, and it's to get you to not know that I'm about to do it. One more. There we go.
In that case, no, anybody can benefit because we do still develop stiffnesses, tensions, slight reductions in our range of motion, which is our ability to move. That we don't exactly that we don't actually realize. Our bodies are really good at hiding that from us. But chiropractors and again all those other practitioners too, it's literally our career to find those little irregularities and fix them up for you, so that you're less likely to be injuring yourself, or you're operating at a higher functional ability, measurable, than you would be otherwise.
Sounds great. I met Dr. Adam like 2 weeks ago in the gym, and we were talking about the chiropractor and how things it's helpful to make you even like healthier and happier eventually. So I was doing the lifting, the healthy food, everything like to be healthier, but I found okay, it would be even like easier to get like a good treatment from a physio or chiro. And I came today, I was like totally surprised with the treatment. So I was like having issues here, having some issues there, and eventually it feels way looser.
Very happy to hear that.
Yeah, it was a pleasure, man.
Yeah.
So yeah, let's talk about like the professional things.
Of course,
so,
of
because
course.
like a lot of like my audience, they are from the Middle East, and part of them they're just like new immigrants. So how to be a chiropractor if someone interested in?
So that is going to differ depending on where in the world you are aiming to reside or be at, right? Chiropractic in Canada, which is where we're based out of, it is a regulated profession. So what that means is that we have a whole organization whose sole purpose is to make sure that we operate within our kind of field of expertise. Okay. There are various parts of the world where chiro is unregulated, which essentially means that anybody could just claim to be a chiropractor and do whatever it is that they want to do. Okay, so typically I don't recommend seeing any unregulated professionals because you never really know what you're going to get. But within Canada, we're regulated, which means that we more or less operate again within this field. So in order to be a part of this regulation, though, in order to be a part of the profession, you do need to pass some really vigorous academic as well as practical examination. Okay, so I myself, I was in school for 9 years. I successfully wrote the board exams, which is necessary for any kind of healthcare related practitioner to become part of their profession, and only then was I allowed to call myself a doctor of chiropractic.
Yeah, we have a nerd here, 9 years of school.
Long time. I'm a mega nerd. I might not look it, but I love to read. I love my job. I'm a big fan of my career.
That's amazing. Yeah, that's amazing, man. So So yeah, like 5 years or like 4 to 5 years of undergrad.
Yeah.
So you should be doing like a bachelor of like science, biology, or anything related to the science, and then you join the Chiro school, which is another 4 years.
So you just small correction there. You could have an undergrad in anything.
Okay.
That's the case for Chiro. That's also the case for med school. Like it doesn't matter what your undergrad is in. What they really more care about are the Casper-based questions, which is basically who you are as a person and how you would respond in theoretical situations. Okay. They would rather take somebody who is empathetic and has strong critical thinking skills than somebody who is in a science degree and just happened to get 90s across the board. 90s are very high grades here in Canada. So yeah, any kind of major. Of course, you'd be at more of an advantage if you took a kin program or a science program, of course. But it doesn't matter what you do your studies in.
That's amazing. Yeah. So in terms of work, like being a chiropractor in Canada, do you have like a good compensation? Let's speak as a general chiropractor. How much does
so that's a very simple question that I get asked at least once a week by students finding me on the internet, but it has a more complicated answer because the income, the paycheck that chiropractors make ranges a lot. Okay, the first thing I'll say is that I'm not sure if this is true or not, but I've read it from multiple sources. Please do your own research on this. Chiropractic students and graduates have the highest rate of defaulting on their student loans as compared to any other doctor profession. Okay, again, I am just quoting that, but please do your own research on that. That might be incorrect. That being said, your income is going to vary based off if you're an associate or if you are a clinic owner. Okay. I was an associate for about 8 months after graduation, and I made abysmal income compared to how much I had spent in tuition fees, right, and my education. I'm now a clinic owner, and I make a pretty good living when I compare myself to other people in my age group. Okay. So you can absolutely make upwards of 6 figures, upwards of 200 if you own a clinic. If you're an associate, you're going to be lucky to break into that 6-figure category to begin with. So if you are entrepreneurial, you can make doctor money. If you're not, if you'd rather just follow orders, you're probably not going to really get up into that range. Yeah. So
you're saying like anywhere between close to 100, 100, like maybe 20 for the associate? Like
So as an associate, I've seen it range from 40,000 Canadian, which is very low for the amount of schooling that goes into it, to a cap of about 120, 130. Okay, that's about the range that I've seen for associates. Clinic owners, I've seen make from 150 upwards to about 300. But it's going to, again, depend a lot on entrepreneurial and business skills because, unfortunately, in Canada, we do have to balance that out, right? You can't just be a chiropractor and have terrible interpersonal skills. You can't be bad at meeting people. You need to be a good networker.
Yeah. 100%. Yeah. So it's the whole package. You have a business mindset, you have the chiropractor, you have the technical, and you're still like good dealing with the people. Yeah. So yeah, there's the whole
absolute caveat there. As a healthcare professional, you do always have to put the patient first. So it can be very confounding sometimes because you got the business on one side and you got the patient care on the other. But when in doubt, the patient care always comes first. You take care of your patients, they'll take care of you. They will send their families in. They will send the loved ones in. They will come back when they hurt themselves, right? So absolutely always prioritize patient wellness above any kind of gain, 100%.
So if someone like has already like finished his school in chiropractor outside of Canada, so would it be okay to practice here?
So it depends on where you did your studies is the answer, right? I know that a lot of Canadian students will actually complete their studies in the States, and the States is compatible with Canadian boards, meaning that if you do complete your education somewhere in the United States of America, you're welcome to come back to Canada and write the CCEB, which is the Canadian Chiropractic Examination Board's exam. And once you do pass that, if you are successful, then you're good to practice here, right? I don't admittedly know about other places in the world. You would need to contact the CCEB directly and ask them that, but I'm sure they would be more than happy to answer that question for you.
That's amazing. Okay, that's great. Apart from this, I'm gonna share with you my treatment today with Dr. Adam.
That's exciting.
So we see a lot of cracks, a lot of like stuff like correction, but I love it. It's amazing, and actually, I'm encouraging everyone, even if you're doing like a good job in terms of like training, eating healthy food, still, as Dr. Adam mentioned, manual therapy, like physio, chiro, anything like physical, that would be really helpful and to help you like move better and like feel better as well. Okay, thank you guys. Don't forget to subscribe. Thank you.
Thank you.
Yeah, appreciate it.
All right. Awesome job.